Hi, welcome to Portage County Matters. I'm Patty Dreier, Portage County Executive. I'm really excited about our show today. This is a show about saving lives in Portage County, so I hope that you'll stick with us for sure. I would like to start with a couple of quick news notes first, and then we'll get to our guests today. First of all, Portage County Healthcare Center, you should be aware of a follow-up since the last show. If you've been tracking the news notes, we did have a resolution passed through the Portage County Healthcare Center Committee on its way to the county board to ask for the funding that will come from the healthcare center's budget, but be able to address the opportunity to pull in the help of a consultant to get us the business modeling that we need to be able to help us make decisions about, do you build onto the healthcare center? Do you build a new healthcare center? What is the appropriate scale and model for today's healthcare center and organizational model and how the funding works in the state and in the nation for healthcare. So we're really looking forward to some assistance coming in to take and lift off of the other work that we've done to drill down into food service, to drill down into healthcare, nursing aspects of the center and get consultant help on those things. Now we need that bigger picture covered. So I think that this business consultant that specializes in healthcare will be the answer for us. That should chart us a course for the future for our nursing home and healthcare center in Portage County. The second thing I wanted to offer you is that July is the month when the county executive presents. It's a statutory requirement that I present in some month of the year a State of the County address. So I'll be bringing that to the county and to you this month of July, and I hope that you will check the county's website for a narrative of the State of the County address, or be able to tune in to the county board meeting, or perhaps even come to the county board meeting in July to be able to hear that address in person. I'll leave the details until next month when I'll report back on what the State of the County address had been all about. As far as a news note that I received even just today as the filming of this show, I was participating in a North Central Wisconsin Workforce Development board meeting for local elected officials. And this is a workforce development organization that serves, it's a nonprofit organization that uses federal funding, mostly anyway, to help us in addressing the needs of dislocated workers. And this board serves Forest County, Adams, Oneida, Vilas, Lincoln, Langlade, Wood, Marathon, and Portage counties. Anyway, a very interesting statistic was offered to us today from the Executive Director, Renee Daniels, of the Workforce Development Board in our region, that over the last 18 months in our region, 5,270 workers were dislocated. Wow. And we talked about the impact of over 5,000 workers in our region being out of work for various reasons, and the work that we're doing to continue to assist those workers in their transition, whether it's a transition to a next job, a transition to a next career through education or skill building, or transitions to other chapters in their own lives at their own choice. So anyway, my kudos go out to the people who are working across all of these counties to help us address this significant need. And the last news note I wanted to offer you was related to corrections in Portage County. I've been tracking a little bit with you about how our capital planning process is underway, how it's a pre-budget planning time for us. And I wanted to share with you a resolution that has come up through the Public Safety and Emergency Management Committee in the county this week on its way to the county board. There will be a lot of news on this, I am sure, but I really feel it's important that I read this resolution to you for those of you that don't perhaps have access to the internet, and for those of you who want to stay abreast of what's happening with corrections in Portage County. Here it is. It's about establishing a new county correctional facility as a priority for future planning and construction in Portage County. This resolution, which went up to the up through the next committees, was I believe it was June 26th that this had gotten through the Public Safety and Emergency Management Committee on its way to other committees in the county. So here we go. Whereas in 2004, the Portage County Board of Supervisors reviewed a comprehensive study of county facilities prepared by the DLR group, and which identified the county jail as inadequate due to overcrowding, which in turn causes a high cost of transporting inmates, thus creating the need to study, review, and implement a new Justice Center facility. In 2004, the Portage County Board of Supervisors endorsed the need to study, review, and implement a new Justice Center facility as the #1 priority in Portage County. And whereas in 2006, another extensive and costly study by Mark Goldman and Associates highlighted the deficiencies of the present Portage County Jail facility, identifying prime factors including overcrowding, poor design and layout, and inefficient staff configurations. The same study highlighted the projected growth of court and criminal cases in the years ahead, showcasing the requirement that any new facility be prudently designed to assure decades of safe and cost-effective use. And whereas subsequent research by the venture architects firm has corroborated and confirmed the conclusions of these earlier studies, finding the need for a new jail. And whereas in 1998, Portage County realized revenues from housing other counties' inmates in the county jail here, but from 1999 to 2012, Portage County has expended in excess of $7 million for transporting and housing Portage County inmates in out-of-county jails, with an estimated additional cost of $600,000 projected for 2013. By 2020, the total estimated cumulative cost to Portage County will be in excess of $10 million. And whereas the Portage County Sheriff's Office has taken extraordinary steps to secure discounted housing contracts and to reduce shipping mileage, but the Sheriff reports that there are few realistic and meaningful cost-saving options remaining. And whereas the inability of Portage County to adequately deal with both pre-sentence and post-sentence prisoners has a direct and real impact on the safety of the citizens of this county, as well as many visitors and travelers who frequent this area. And whereas, and I promise you we're almost finished with this resolution, but it's really important that you hear it all. Whereas Portage County, through its Justice Coalition, Space and Properties Committee, Public Safety and Emergency Management Committee, other committees and county officials have affirmed the need to revise existing practices and the need for an integrated new approach to the local corrections activities, including services and support for rehabilitation, in addition to the need for punitive measures in the system. And whereas Portage County has been successful in implementing programs aimed at providing an alternative to incarceration for many years, and has now been given the very unique opportunity to pilot a community-based rehabilitation program for the Department of Corrections, but lacks the space and facilities to implement this opportunity to the fullest extent possible. And whereas Portage House has served as a model for the state of Wisconsin for transitional housing, but the facility is at its maximum capacity and in significant need of renovation. And I just toured that facility yesterday. That is an absolute yes, 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 very much in need of renovation. The fiscal note on this resolution says there are no fiscal obligations for the county immediately associated with this sense of the board resolution. Now, therefore, be it resolved that the Portage County Board of Supervisors does hereby endorse the concept of constructing a new unified correctional facility institution housing the jail, juvenile detention facility, rehabilitation programming facilities, and a transitional housing unit in a single structure connected or incorporated with the circuit courts. Such construction should commence upon a professional evaluation and plan development in 2014. Be it further resolved that the Portage County Board of Supervisors declares that it is its aspiration to construct for construction to begin in 2015 or as soon as practical thereafter. Be it further resolved that the Portage County Board of Supervisors urges the county executive to include the cost of said evaluation and plan development in her 2014 Capital Improvement Project Plan and 2014 County Budget Proposal. Be it further resolved, and this is the last one I promise you, that the Portage County Board of Supervisors desires the prominent inclusion of this concept and the specifics of this resolution be incorporated into the Portage County Strategic Plan currently under development by the County Executive and the County Board, dated July 16th as it moves toward the County Board for action. So I wanted to make sure that you were privy to that information, timely information. I don't disagree that there's a need for a correctional facility here in Portage County that tends to this continuum of programmatic and punitive options. But I'm also urging the county board to ensure that we don't zero in only on this project without consideration for the larger, more strategic physical facilities planning effort that we very, very much need here in Portage County, so that we can make sure that what we build is smart, that what we build serves us well into the future and in context and consideration for other county missions and facility needs that we have here serving our county government and community. I am also urging that we create a phased-in plan so that we can finance all of these different phases into our future, and that we plan for renewable energy and other energy considerations that will make a long-term difference in the cost savings on the bottom line for not only our facilities and transportation-related operations, but also on the bottom line in taxes for the people of Portage County into the future. We want to do what we can to hold the line on those taxes. So anyway, that is the news report for the show today, and now I'd love to direct my attention to those waiting very patiently. Dr. Michael Curtis, who's an emergency physician at Ministry St. Michael's Emergency Department, and also to David Gliniecki, who is a cardiac arrest survivor, and we've got an awesome show for you to target a program and an effort that's going on in Portage County to save lives. The CAST program, it's Cardiac Arrest Survival Team, and what we're doing is we're really ramping up the effort to help us build capacities in Portage County to save more lives. So I'd love to direct my attention to you, Mike, and to ask that you start us off in talking about cardiac arrest and how CAST fits into the picture, if you could.
Sure. Well, as you know, we have a great EMS system in Portage County, and probably the envy of many other counties and rural counties in the state of Wisconsin. But one of the things that we'd like to try to do is create this cardiac arrest survival team for the purposes of focusing in on cardiac arrest survival as a specific issue. And the EMS system really can do so much with respect to cardiac arrest survival, but we really need the citizens of the community to become more involved, not only in terms of learning CPR, but putting AEDs in the workplace, training workforces to know how to do CPR and how to use an AED. And then we need more people to join their first responder groups in their local communities out in the county and things like that, so that we have a stronger base for increasing cardiac arrest survival. So
let's talk about the difference between cardiac arrest and heart attack. Many of us don't even fully understand what that means.
Sure, and I think the terms often get interchanged, but inappropriately so. Really, a heart attack is when there's a blockage in one of the arteries. As David often refers to it, it's a plumbing problem in the heart.
Oh, interesting.
Yeah. And so a heart attack is when you have a blocked artery and the muscle in the area that's normally supplied by that artery is no longer receiving blood or oxygen or nutrients because the artery is now blocked. So a heart attack is something that doesn't always kill people. Sometimes they do kill people, and sometimes heart attacks can cause cardiac arrest. But not all cardiac arrests are caused by heart attacks or even plumbing problems in the heart. They can be caused by other things as well. So there's a big difference. So cardiac arrest is when the heart actually stops beating, and a heart attack is when the heart loses, part of the heart muscle loses its blood supply. That's the simplest way to put it. A heart attack, most people are going to survive their heart attack if they get medical attention in a timely fashion, whereas cardiac arrest is something that will absolutely kill you if you don't get any medical attention within minutes.
Wow, some of us would have thought it was the opposite, you know? So this is part of the public education effort, I am very sure.
And I think sometimes people confuse these terms. It's very difficult to understand. And you often hear people refer to something called a massive heart attack, like so-and-so died from a massive heart attack. Well, probably what they really mean by massive heart attack is a cardiac arrest. sudden cardiac arrest. But the term massive heart attack is really not a medical term. That's sort of a colloquialism. I can't even say that. Yeah, it's a common term, but it's not really an appropriate medical term.
So here we are. We've got this EMS system in Portage County, a countywide EMS system. We're already working hard to get out there when that call comes. But the bottom line, at least as I've learned it, is that the greatest way to save lives is to have some assistance on site before an ambulance even gets there. So will you talk about that a little bit? And I want to make sure that, David, we get you in early here in the show so that you can weave in your story. But let's just start with what capacities we're talking about, and then we'll transition to your story.
Well, the ambulance sometimes gets to people very quickly. If you live in the city of Stevens Point and you're close to one of the fire stations, the ambulance can get to you quickly. Or if you're in Plover, and the ambulance can get to you quickly when they're based in Plover, or if you live in Amherst, there's an ambulance there now that can get there quickly. Of course, there's also first responders in many, many places throughout the county. In fact, the entire geographic surface area of Portage County is covered by first responders. But for many people, there's a time lag, and because they don't live close to where the first responders live, or they don't live close to one of the fire stations where the ambulances are deployed from. So there can be time lags that exceed 10 minutes. And, survival from cardiac arrest decreases by about 10% for every minute that the heart is not beating. So by 10 minutes, you've essentially exhausted all hope of being resuscitated.
So when folks are, like if I'm in your presence and you were having a cardiac arrest, then when I can render aid through CPR, for example, or if I can get access to an AED
Sure.
as soon as possible and get that started, then that's going to quite likely change the outcome until the ambulance arrives to be able to take it from there. And we're really talking about building these capacities in the picture.
Exactly, and I think it's a sort of, in a sense, it's an extension of the EMS system that allows us to intervene in this one particular type of emergency situation even before any EMS providers get on scene. But if we can initiate CPR within a few seconds of the time the person goes down, or a few minutes of the time the person goes down, and if we can use a defibrillator within a few minutes after that, people stand a very good chance of being resuscitated. But if we go 5, 6, 8, 10 longer without any CPR or without any AED, shocks, the chances of survival are essentially nil. I mean, they're not zero past 10 minutes, but it's so small, it's really unfortunate we can't save more of those people.
So David, you have a story to tell, and again, I appreciate you being here.
I am here today as a result of things like what Dr. Curtis started and the EMS system in Portage County did. I'm also here because people in the community, just specifically where I was at, had been trained in CPR and AED use, and they acted very, very quickly. This was April of 2012. I was at Adventure 212, and at the end of about a 50-minute workout. I remember being on a bike, feeling just a little dizzy, and that was it. The next thing I remember, I was waking up, I was on a gurney, and I had no idea what had happened. So the story that I got from the other people that were there that acted, I crashed off the bike, went right into a corner. There was a cardiac care nurse that was working out there at the same time. I'm a professor from the university that teaches CPR and first aid. They were there. The staff that was right there, they pulled me out of the corner, laid me down, started CPR. It was probably less than a minute after I'd already crashed into the wall, and it was out. The AED unit was about 10 feet away on the wall. They pulled the AED unit, and I don't think I went 2 minutes from the time that I crashed off before they'd already shocked me once. They had to administer a second shock, and I was back in a normal rhythm. When that had happened to me, they pulled me out. One of the staff members told another staff member, call the EMS services. From the time EMS got the call until the time they actually arrived was 10 minutes. I mean, they've got, the log on that thing. And what I've learned since then is that's probably about 5 minutes too long. And that was fast. 10 minutes, you think, how can you even get out of the building in less than 5? They got there. I woke up. I was disoriented and that kind of stuff. But I was ambulatory. I was talking, little confused. And every place I went after that, everybody said, based on what happened to you, oh, you're the lucky one. Oh, you're the lucky one. And at some point, my wife and I would ask, well, I'm the lucky one. What are you talking about? Don't those AED units work? Had nothing to do with the AED unit. I think one physician had told us that, well, yeah, they're practically idiot-proof, but you have to be where they're at, and people have to act. And that was the thing. The community, the people there, that community had been trained, and they acted. And I think that's what the cardiac arrest survival team is trying to do, is to expand that community of people that know what to do and that will act. In a lot of cases, people might have an idea about what to do to act, but they're afraid to do it. And I would not be here today if those people would not have done that. You can't say thank you enough. And what I've learned about cardiac arrest since then is that it's a lot more common than people believe it is. There's a lot less research that's put into it. And at one time I had done some fundraising work with the American Heart Association, and in a meeting there they had told us that the reason for heart research in that was to keep whole families, not holes in families. So I'm here, and there's not a hole in my family because of that, what that community had done. And so that's what we're trying to expand here in Portage County.
I'd like to expand on what you said and say that there's also not a hole in our community, right? Right? And so what we're looking at is trying to put the message out that we have more employers that invest in an automated external defibrillator than AED, and they run something from $1,500 to say $3,000 to be able to put them in appropriate places, and then to ensure that there are workers in those places that are trained to use those pieces of equipment. I know we had that kind of training at the county when I was a county employee, and we'll have to check on what's that cycle, when are we going to bring those kinds of trainings around again. But also that we remember that CPR is part of the picture, so that folks can get themselves certified in CPR. The CPR methodology is different than it used to be. It's actually simpler than it used to be for many of us that were trained in the old and trained in the new way, right? But anyway, so with that said, now CAST, the Cardiac Arrest Survival Team, you've got a board of folks such as yourself, David, such as yourself, Dr. Curtis, who are working on this effort in the county. We have a way for folks that can help to either get the word out, participate in other ways, or donate so that the fund will be available to help us build this capacity, right? And perhaps you can talk a little more around what the CAST activities have been and how do people get involved.
Well, I think so far what we've done is we've gotten ourselves organized. We pretty much came together about last October. And since then, what we've done is we've created the CAST Fund in the St. Michael's Foundation, and people can donate to that. And there'll be information, I think, that they'll put on the screen for how to donate to that. Or they can just contact the St. Michael's Foundation to learn more about how to donate to the CAST Fund. But the money that we use for the CAST Fund will undoubtedly help us to promote more of these programs, AEDs, training, et cetera, and hopefully someday even purchasing more equipment to help train professionals and so on as part of the continuum of the system. But the CAST Fund, so we've gotten that established, and then we've also, we made a presentation at the Portage County Business Expo, and we're starting to get up and running with giving presentations to various types of community groups. We're going to meet with the Rotary group in August. And we welcome actually invitations from any other type of civic group that would like us to come and give a talk about this. But I think one of the other things that's happening, at least in the city of Stevens Point, is that when the fire department is doing building inspections, they are now asking about the presence of AEDs in businesses. And if they don't have an AED, they get a handout that explains what they're all about and encourages the business owners to get one. And if they do have one, then that's documented, and we keep track of that. We're cataloging all of these AEDs throughout the community now.
Great.
So.
Now, if folks are interested in getting in contact with the cardiac arrest survival team, it'd be very easy for them just to contact the county executive's office. We'll get you connected. Or you can access the information that'll be on the bottom of the screen. So either way, we'll make sure that folks get every bit of information that they need as they go along here. Talk about our cardiac arrest survival here in Portage County compared to other places in the state and nation.
Well, we're doing a pretty good job, really. And the important thing to understand about the survival rate is that it's determined by the number of people who survive witnessed, shockable arrests, okay? So, in other words, it has to be witnessed, so somebody actually saw you go down, like in David's case, and the initial rhythm has to be shockable. So when they put the AED on, the machine tells everybody to shock the heart, so to push the button to shock the heart, okay? So if it's not witnessed and if it's not shockable, then we don't count those people in the denominator of the equation, okay? So where we're at today is about 40% or so, 40 to 45%, kind of in that territory. And it's a little hard to know the exact numbers because they change so quickly, but the last time we looked at it, I believe the number was actually 44%, but it's going to change from week to week based on the number of cases that we have.
Sure. And how does that compare with the bigger picture?
Well, I think nationwide, when you look at witness shockable arrests, the number is probably closer to 15 or less, and it depends on the community because it varies so much from one community to another. But nationwide, probably around 15% would probably be the top, the maximum that you'll see.
As we look at an aging demographic, increase, right?
Yeah.
There's going to be some extra reasons for each of us to build our own expertise and capacity and confidence in taking the kinds of actions we may need to help our neighbor.
Dr. Curtis we had a meeting of cardiac arrest survivors in Portage County a few weeks ago, and that was what in looking at that thing, the ages of people varied from 50 to 83. Generally, most of the people were early 60s to mid 60s, okay? But from age 50 to age 83, that was, everybody had gone through cardiac arrest and had survived. So it's not just retired people, okay? And that's what people have to understand. And the other thing is that, our survival rate in Portage County saying, 40, 45%, and nationwide it's 15% or maybe a little bit lower. We're doing a good job here, but it's only 40 or 45%. And look, I guess if business people or the general public is looking at this, look at the lost potential.
Exactly.
That's the thing. Look at the lost potential that's there, that we lose track of people that have been trained in whatever job that they've been doing or that are providing services and that thing. And that's the thing. It's not cost effective to lose those trained people.
Exactly.
And we lose so much more value to our community. I want to say thank you to both of you for being here today. David, for sharing your story and for becoming an activist around this, making sure that our community doesn't have those holes and that fewer families have those holes anymore. And for Dr. Curtis, all that you do to help us in emergency medicine in Portage County. Oh my gosh, it's a bit legendary. So I just really want to thank you and your staff and all the folks over at the hospital and in our EMS system for sure in Portage County. Next month, we're going to have a guest that will talk about Farm Technology Days. It's about a year to go. We've got great news about what's happening for Farm Technology Days, and we'll have a great, great show ahead. So thank you for joining us, and thanks for getting involved in our cardiac arrest survival team efforts in Portage County. Thanks.
You.